Hello, Namaskar everyone. Today we have Sri Anand Baparji with us. Already we have made a long series on Shivambu, that is urine therapy. He has given his enormous knowledge, guidance about how to use the Shivambu in different culture, what is the composition of Shivambu, what are the chemical constituents of the Shivambu, what are the difference between urine and Shivambu. So please go through our Shivambu series on YouTube and you will come to know all information about the Shivambu series. Today here we are going to discuss a different topic related to Shivambu. This has been asked by our viewers so many times, so that we come to know that we have to make video on this topic. So here we gathered with Sri Anand Baparji to make a video on aged Shivambu, that is aged urine. So here we are going to discuss about how to age the urine, how to use it externally, what are the different compositions of aged urine and its various applications, pros and cons in brief. Okay, so I would like to hand over to discuss with Sri Anand Baparji about Shivambu, aged Shivambu. So I would like to ask you, what do you think aged urine is used for?
Okay. Now, aged urine is a slightly different concept from drinking Shivambu, which is fresh. Aged urine can range from 1 week old to months old to years old. Traditionally, according to the Dhamma Tantra, they have talked about the fact that drinking urine or drinking Shivambu is only to be fresh Shivambu. And where they have talked about external use, they have referred to it in terms of it should be reduced to a quarter. They have not said anything about age, they have not said anything about how to go about it. All they have made a reference is it should be reduced to a quarter. Now, when we talk about reduced to a quarter, it puts up a whole new ball game of how this could be achieved. I have been using aged Shivambu stored in bottles for the last 25 years. And I have noted that if I fill a 1 liter bottle of urine and store it, there is very little loss, maybe about 5 or 10 ml at the most. The only change happens is in color and the smell, that you get the typical ammonia smell. But when you are talking about reducing to a quarter, it then leads to an issue of how was this being achieved? Is it a case of living in mud pots out in the open for just evaporation to bring to that reduction in quantity? Or was it a case of they boiled it? And none of this information is clear in the Dhamma Tantra. The shlok only says reduce to 1/4 for external use.
Oh.
From our perspective, we cannot keep urine pots out in the open to age it or reduce it to a quarter all the time. Neither do we know how long it will take, because depending on season, for example, in the northern hemisphere where it's very cold, if you keep it out in the open, it may turn into ice or get converted or stay frozen.
Right.
How is it going to reduce?
Yes.
Whereas in the tropics, it may reduce very quickly within a day or 2 days or 3 days. We haven't looked into that. We have tried to look at how we might want to do it in the modern era. So we'll talk about that later. But that's what the literature says.
Okay, so is there any specific reference to this literature?
Okay. Shivambu Kalpavidhi is a chapter in the Dhamma Tantra, which is one of the original texts, and it is the only substantiative literature on Shivambu across the world. It has got 107.
107.
It has got 107 shlokas, which is an exhaustive data on Shivambu, its use, its prescriptions, internal use, external use, pharmaceutical potions to be added, etc., which no other text anywhere in the world or references provides so much information.
Right.
We know Indian literature where there is Ayurvedic texts make occasional references to some aspects of Shivambu in one or two shlokas. There has been mention that the Bible has got some references and Quran may have some references, but these are all the odd shloka or the odd stanza or the odd line.
Right.
So we feel that the Damar Tantra Shivambu Kalpavidhi chapter is an exhaustive, all-inclusive, complete treatise on Shivambu to help us understand Shivambu in all its depths.
Right. Okay. So, is there any specific process mentioned in the ancient literature, and have you feel that this process is really working?
Okay. Talking about aging of urine, as I mentioned before, they talk about collecting in mud pots and reducing to a quarter. And they have not given any data about whether it should be boiled or left in the open or left in the sunshine.
Right.
We decided, based on our experience of using Shivambu, I have used Shivambu from 3-month-old to 2 to 5-year-old stored Shivambu. Now, one of the problems in storing Shivambu is if my health is compromised in any way whatsoever, then when I collect my urine within 2 to 3 or 4 weeks, I find that there may be fungal growth, there may be microbial activity, and sometimes we have also found that some samples have got worms growing in.
Okay.
Now, this is definitely a no-no, big prohibition for considering using that stored urine for therapy, even if it is only for external use, because we have experienced that fungal growth, and if you use it, it makes you very itchy.
Right.
I'm sure worms and other microbial growth will have their own side effects on the body.
Mm-hmm.
So, keeping all that in mind, we need to be very careful and make sure that there are no growing elements within that sample that you have collected.
Right.
Since I have been practicing Shivambu for many years, today I find that my Shivambu stored does not have worms, does not have fungal growth, does not have any ill effects, and I have been able to store it for years, getting beneficial results.
Yes.
The problem starts is when I have to deal with a patient. I have been treating patients using Shivambu, and when I have to deal with patients, if there is a chronic case that requires age urine to be used for external purposes, for their particular malady,
Right.
then we cannot wait for 2 years for that person to collect the urine and wait for 2 years before we can apply it.
Yes.
So the next best solution is looking at the ancient texts where they specifically said reduce to a quarter. We get the patient to collect their urine into 2 or 3 or 4 liters, boil it and reduce it to 2 liters to 500 ml or 4 liters to 1 liter up to a quarter only. Now I'm very specific about this when I say up to a quarter, because we once had a patient who either by desire or oversight, he reduced it to 1/5 and he thought that will be okay. But when he applied it to the body, instead of being beneficial, it actually became aggravating.
Okay.
And he very soon realized that that wasn't a good idea,
Right.
because quarter worked therapeutically wonderful enough that he got cured of his problem. But when he tried that extract reduced to 1/5, it actually gave him allergic reaction within 24 hours.
Right.
So we know that reducing to a quarter using boiling is a modern way of achieving the desired prescribed system as per the Brahman Tantra. And we have found it quite beneficial with patients therapeutically, giving us great clinical results.
Okay. Is there any modern way for aging the urine?
Okay. There are two ways of aging urine. One is the traditional way where we actually just put it in bottles and put it aside and hope like hell that there are no worms, there are no microbacteria, there are no fungal growths, and you can keep it for a few years and then gain. The other one is that I just mentioned, boiling and getting it to the desired level so that you overstep all that growth problem because you are merely using 2-day, 4-day, 5-day fresh urine to be boiled to a quarter. And that is the better way. Now there is talk of some people saying we keep it in sunlight to get better results.
Right.
One of my concerns is, as you all know, if anybody is suffering from a urinary tract infection and the urine does not exhibit that in the first instance, they do a culture growth.
Right.
Now, one of the things that they do in culturing the bacteria is put it in warm solutions because that helps the bacteria grow. Now, if you're going to do the similar thing by putting it in sunlight every day, then the possibility of changes to the urine and its components and growth of microbial activity is going to be immense. And we do not know how it's going to affect us because today we know that our gut has got trillions of bacteria, trillions of viruses and thousands of fungi. But we really don't know the full name of each and every one. We don't know which are active, which are passive. We do not know what triggers which bacteria for positivity or negativity.
Right.
And only way we know is by clinical experience. So if I do some exercise or if I eat the right kind of food, I find I get good results and I feel better. So we postulate that my gut bacteria is doing well. But we really have no idea which gut bacteria was doing better and which gut bacteria was eliminated.
Right.
Or kept quiet. So our knowledge is very insufficient when it comes to the modern way of thinking of identifying bacteria, identifying viruses and stating that Shivambu or any other pati is going to influence these bacteria and viruses to make us better.
Okay.
It is a sad fact of modern medicine that we don't talk about it openly because then I believe it shows that we do not have enough knowledge.
Right.
But that's the reality of it.
Right.
So it's very difficult to postulate and say putting it in the sun will be safe. My suggestion is go with safety. So do not play with fire in terms of parboiling it or warming up the urine or keeping it in the sun. Either store it in a cool, dark place consistently and make sure that there is no fungal or bacterial or worm growth.
Right.
And if that happens, then you're on the right track.
Okay. So after listening to this, that modern techniques do not have that much sufficient knowledge. So I would like to ask you, what do you feel about the using of aged Shivambu and its processes?
Related to external use or internal use?
I would prefer to ask first related to external use.
Okay, all right. We have found over time that the more aged the urine, the more caustic it gets. We know for a fact that fresh urine has got high content of urea.
Right.
And we also know that when it is stored, the urea converts into ammonia and thus the color of the urine becomes a bit darker and the pH definitely rises.
Right.
We know most people's urine is acidic, so 6, 6.5, 5.5, somewhere in that range, or sometimes can go up to 6.9 or 7, slightly alkaline. But as we age urine, we know that the pH increases to 7.5, 8.5, 9.5. Now we all know that at that level of pH, that the caustic level of alkalinity is harmful to the skin and tissues.
Okay.
What we find when we apply that to the body is it cleanses the skin thoroughly. I suppose soap does something similar. Soap also has got some caustic ingredients.
Right. Potassium carbonate or sodium carbonate.
Correct. So similarly, we have found that aged urine when applied to the body cleanses the skin thoroughly. We have observed that if you apply it in your hair, people suffering from dandruff disappears like that. Now that doesn't mean you apply it like a hair oil and leave it there for hours. You apply it and within about an hour or two you have a shower without soap.
Right.
And that much cleansing is enough to keep the body nurtured towards better health. We have also used age urine for applying to our teeth.
Right.
And we find that the teeth become shiny and glistening and clean. But when you use it on the teeth, one of the problems with the teeth is if you use a bit too much, it touches all your mucous membrane of the mouth. And we tried it once with a mouthwash with 2-year-old urine, 2-year age urine. And what we found to our surprise was the mouth, teeth, tongue became very clean. But along with that, the mucous lining of the whole buccal cavity, the oral cavity, was cleaned out. Literally like you could pull out all the tissue for the next couple of hours. The mucous lining was gone and you could also sense that there was sensitivity to the in the mouth.
Right.
Looking at that, one of the concerns I have had ever since and still have is the fact that age Shivambu is only good for external use. The moment we use it for internal, where there is gentle mucous membranes, the chances are you're going to do some damage. Because if you remove the lining like that completely, then the protective mechanism of the skin is reduced. We have also experimented with using it on the eyes. What we have found is the eyes definitely get cleaner, but like anything with high pH, it stings a lot. So I would not recommend it to anybody who is not game to do it.
Right.
But if you do it, make sure in the next 12 hours you wash your eyes thoroughly. The other thing we have observed with the eyes is when we use Shivambu for the eyes tend to come out with a lot of gunk, the yellow stuff. And that is part of what I refer to as the cleansing process. And this may happen for a few weeks and then after that it eases off. We have not used it anywhere else. We have used it on the hair, in the body, and we have had fantastic results.
Okay, so after listening this, I come to know that there are a lot of risk involved when we use aged urine internally. So do you highlight some of the risk involved in drinking urine?
Okay. I strongly feel after the oral mouthwash experiment where I lost a lot of mucus lining of the oral cavity for the next 2 days, that the oral cavity is still tougher. As we go down the throat into the gut all the way to the intestines, the mucus lining is much more delicate. With that much delicate mucus lining, if we were to drink aged Shivambu, we are more likely to do damage without realizing we are doing any damage, and that is my bigger concern. I suppose similar damage is caused or similar damage may be caused by smokers, people who chew tobacco, people who take drugs, people who are sort of severe alcohol consumers, or people who eat very strong chili and ginger and hot spicy food.
Right.
All these cases are known to have cancers and gut ulcers and oral cancers, etc., because they do damage to the mucous lining and then go on to do damage to internal tissues. I suspect a similar thing can happen with Shivambu, the use of aged Shivambu internally. Now, one of the things that I noticed with some curiosity was there appears to be a lot more Western authors who are propagating use of aged Shivambu.
Right.
I took the trouble to connect with some of them and I had my concerns, so I spoke to them and connected with them and asked them what their experiences were and whether they agreed with it and what they felt about it. Unfortunately, they did not respond and answer my questions.
Oh, really?
Yes, that's a sad state. I
Right.
expected them to be much more informed when they are writing books about it.
Yes.
It also came to my observation that some of these authors, when I spoke to them, they had only experience about themselves and they had written a book.
Oh.
They had not gone out and practiced with 10, 20, 50 other people who are suffering from different conditions.
Right.
Got them to drink 8 Shivambu and then see whether they had similar results or different results.
Exactly.
That to me is a big issue, because in my practice and in my way of thinking over the last 30 years, I have practiced Shivambu across so many patients with good results that I would dread to think that I would prescribe 8 Shivambu to somebody to drink and find that they have ulcer or cancer or some growth where the mucous lining is damaged and it causes further complications. Knowing that this happens, and this is a reality purely because of the high pH and the caustic nature of alkalinity that we are ingesting, it only makes sense that it is a straightforward no to drinking aged Shivambu, as far as I am concerned.
Right. Okay. So, thank you, Sri Anand Baparji, for giving us an detailed information about the aged Shivambu. Here we come to know a lot of information, how to process, how to use, and what are the risks involved in drinking the aged urine. Thank you for this information. Thank you.
Namaste. Thank you.